This article in the New York Times is massively irresponsible. And did you know there were 2 articles published on the same day, same authors? They're a little different. Let's compare. Inside the booming business of cutting babies' tongues. Doesn't it sound scary? This is the first article, the one that's being promoted on social media. Here's the other one, what parents should know about tongue tie releases. So you can already hear the tone difference between these 2 articles. Let's see if these articles are different in other ways. First, here's kind of the hero image of the article. This is a baby, looks pretty uncomfortable, pretty medical looking picture. This is a strikingly different image. A baby nursing, there's a helping hand there, mom or parent is holding the baby. Tone difference. The smaller headline, dentists and lactation consultants around the country are pushing, quote, tongue tie releases on new mothers struggling to breastfeed. So what do we think about the professionals that they're about to talk about in terms of like the words that were used to describe them? Well, they're pushy. They're pushing something in quotes, so it's probably not valid. On new mothers struggling. So it gives you sort of a sense that these professionals are taking advantage of somebody in a vulnerable position, right? Here's the other smaller headline. Tongue, lip, and cheek tie releases are often recommended to help with breastfeeding or prevent health problems. Few studies have shown benefits. This is not false, but I think the choice of tone sends a very different message here. Let's go back to article number 1. They start off by telling the story of a mom and baby who were struggling with nursing, and so they hired an IBCLC, International Board Certified Lactation Consultant, for help. Article number 2 talks about how this is a pretty common scenario. A lactation consultant helps a newborn and suggests that maybe cutting a tongue tie might be helpful to help with breastfeeding pain or feeding difficulties. They talk about how the quick procedure known as a tongue tie release involves a dentist or doctor snipping a tight band of tissue, this under the tongue, that might restrict the range of motion or how babies' tongues move. In recent years, lactation consultants and dentists have aggressively promoted the procedures, even for babies with no real signs of tongue tie and despite the risk of complications. Article number 2 links to article number 1. That's interesting. Article number 2 talks about, let's go up here, how breastfeeding a newborn can be hard even when it's going well. So true. Lots of parents struggle, and it can be discouraging, especially for tired, struggling parents. Lactation consultants can provide support in those early days. Lactation consultants have extensive training. In any field, you're going to have bad apples, but most lactation consultants work very hard to provide exactly the right recommendations to help each parent and child. Article number 1 continues to talk about baby Eleanor and her mom. She was referred for a tongue tie release, and they describe how after Eleanor's procedure, Eleanor was unable to eat, and Eleanor subsequently required a feeding tube. I don't know anything about this family. I've worked with lots of families with feeding tubes, lots of kiddos with tongue ties. I have so many questions. It is exceedingly rare for a tongue tie procedure to result in the need for a feeding tube. Feeding tubes are typically placed because children have trouble swallowing. There's all different kinds of reasons, but none of that other information is presented in this story. And it may well be the only thing. I don't know this family, but the authors did not include all the information. They didn't talk about speech-language pathologists or feeding specialists other than the lactation consultants and the dentist that worked with Eleanor, what was tried, what other things were going on. Eleanor's mom talks about how devastating this was for their family, that they felt like they paid to harm their baby and made the wrong choice. I don't, again, discount her experience at all. It's terrible. The dentist talks about how he feels terrible. He said this was one bad outcome of nearly 800 such surgeries and referred the Times to 2 other clients who had good outcomes. Those clients weren't talked about in this article. He did say that he decreased the number of surgeries he was performing because he, like many others in the field, realized that babies could be being over-referred for the procedure. Article number 1 is using terms like money grab. They bury in the article that serious complications like Eleanor's are rare, but then they immediately contrast that by saying doctors said they seen cuts cause such pain that babies refuse to eat. And oh no, scary, scary, tongues can now block airways. Guys, these complications, they do occur, but they are exceedingly rare. And if you compare them to many other procedures that any of us might need, we find similar information about rare complications. Then we have words like guilt, tipped into depression, spent thousands of dollars on chiropractors and speech therapists who claimed their services were necessary for successful recoveries. I am a speech language pathologist. If a baby has a feeding challenge and they have a tongue tie procedure, our services are necessary in recovery. We need to help parents understand the way that their infants are now eating, give them tips because they still might need some supportive strategies. Nowhere in this article does it discuss the role of a speech language pathologist or occupational therapist as a feeding specialist who work with children with tongue ties in the presence of other things too. Article number 1 continues to talk about information that was released by the American Academy of Pediatrics suggesting a wider range of babies might benefit from assessment and treatment for tongue ties. Following that time, there was a significant increase in the diagnosis of both tongue ties and cheek and lip ties. So similar idea, this band of tissue under your lip tethers your lip to the gums right between your teeth. That can cause issues with the way that your teeth grow in, but very rarely impacts long-term outcomes. Article number 2 shares some actually really helpful information that a small share of babies actually are born with a tongue tie, and that might impact breastfeeding. All true. Pediatricians say it's easy to identify, and there are some different techniques that we use in an oral exam looking at a baby's mouth that can help us see, oh, it does look like that band of tissue might be tight. However, this is what I want you to know as parents. If your baby has a tongue tie, that does not automatically mean a release is necessary. What it means is you need an expert to evaluate. Pediatricians are great. I love pediatricians, but they are not trained in the mechanics of feeding. You need to see somebody who is trained in not only feeding mechanics, like a speech language pathologist or occupational therapist or an IBCLC, and we need to look for all of the other reasons that your baby might have difficulty eating because it may not be that tongue tie. And the danger in assuming it is or referring for that particular issue first without investigating other things is that you miss other things that could be having a very real impact on your baby's eating, and the problem can get worse. Next section in article number 1 entitled Profit, Greed, and Ignorance. So when I read this, I think I'm probably about to read some information about bad people who are doing bad things because they're greedy. Authors discuss how tongue ties have been around for centuries. They talk about how it wasn't really discussed much when babies were more bottle feeding than breastfeeding, but now it's making a comeback because breastfeeding has made a comeback. They share more misinformation saying that sucking from a bottle is easy, but to breastfeed, infants must learn to use their tongues to extract milk. Wrong, 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 wrong. Infants use their tongues to eat in any way that they are eating. They just use different patterns. The article then quotes Catherine Watson Jenna, and she says everything looks like a nail because everyone's got a hammer now. This is true. In professional groups and lots of professional discussions, whenever someone has a difficult case, I anecdotally, this is my experience, this is not scientific evidence, have seen an increase in people responding, check for tongue tie, check for tongue tie, check for tongue tie, not in the context of also check for all these other things. As speech language pathologists, we must make a differential diagnosis. It means we have to consider all of the possible things that are impacting eating. And when everyone has a hammer, sometimes the nail is the thing that everybody sees the most, to the detriment of all of the other things that can impact feeding. They bury in the article, while lasting problems from oral releases are rare, they can be wrenching for families. They tell a couple more stories about terrible outcomes, not arguing that these parents did not have this experience. All I'm saying is this was a very imbalanced article. Article number 2, another subheadline, complications are rare, but they can happen. That's a really interesting tone. So that tells me most of the time, it's okay. A little bit different feeling than the other article. Then they go on to say the vast majority of dentists and doctors that they interviewed agreed that releases, which take a minute or two, have low risk of harm, but complications do happen. What procedure does not have a risk of complications? It's hard to estimate the precise rate of problems because no one systematically tracks them. Doctors say the most common problem is oral aversion. Let me tell you as a feeding expert that when an infant has this procedure and they do have pain after, because they have had negative experiences prior to, this can be just one more thing that causes them to feel, oh my gosh, this eating thing is not comfortable, and avoid it a bit. Most babies recover from that. If the baby has lasting problems after the tongue tie procedure, I would be skeptical of anyone that says this is the only reason. Article number 2, subsection that says small studies have shown that tongue releases can reduce nipple pain. True. So now they're talking about some of the complications that a tongue tie can cause for a nursing parent, and that this procedure for some families can help. The procedure didn't necessarily show an impact on baby's ability to eat, but it did lead to mother-reported improvements in breastfeeding and potentially nipple pain. If you have ever breastfed or chest-fed a baby and felt significant pain, I did with all 3 of my children, you do not enjoy that experience. It is very, very difficult. Your stress level is very high. So this is not an insignificant